Hi, I'm Dr. Ann Kellams. I am a professor of pediatrics and director of the UVA Breastfeeding Medicine program at the University of Virginia in Charlottesville, Virginia, USA. I'm going to talk for a second about a question I get all the time. How often should breastfeeding newborns eat? Spoiler alert, it's actually whenever they cue. So here's a myth that I was taught. Babies need to eat at least every this many hours, whether it's 2 hours, 3 hours, 2 to 3 hours, 3 to 4 hours. Some people say, oh, well, if you're this gestational age, it's this. If you're this gestational age, it's that. The bottom line is it's not about the clock. We know that newborns need to eat at least 8 to 12 times a day, but it needs to be on their schedule. There are, very limited amounts of golden concentrated drops of colostrum or early breast milk or first breast milk, and that's all they need, but they do need it very frequently. So we want to make sure that every time they cue, we're catching them. We also know that the mothers need frequent attachment, that's the latching on of their baby to the breast, and or hand expression or pumping, some kind of signaling with milk removal to tell her body that, yay, the baby's here, and actually we're going to want more milk within a couple days as soon as the baby needs it. So it is going to be very frequently, but it needs to be on their schedule when they're cueing. This is a study that looked at the newborn sleep stages, and it turns out we have a lot of data to say that newborns go through all the different stages of sleep, deep sleep, light sleep, alertness, etc., but very, very frequently. This study used a digital app, and for 277 children aged 0 to 2 years, I'm just showing you the data for 0 to 2 months. There were 22,000 recorded sleep sessions where the parents would enter, is your baby asleep, is your baby awake? So what they concluded is that from birth to 4 months, there's a high frequency of very short sleep sessions, usually lasting fewer than 2 hours, and relatively few longer sessions. So if you look at the top portion of this graph with the y-axis, it's the hours of the length of sleep, and across the x-axis was the time of day. You can see that very few of the sleep sessions were more than 4 hours. So we really can and should rely on baby's cues. We call this responsive feeding, so again, watching the baby, not the clock, and it's been associated with improved outcomes for babies. More stable glucose levels, less trouble with pathologic jaundice, and then an interesting one to me is more breast milk intake on day 3. So if parents are taught to feed their baby whenever the baby wants, that baby is receiving more milk on day 3. And why do you think that is? I think it's because of signaling. I think if they're allowed to signal as much as they want, then mom's body responds by producing more milk, and by day 3, they're well along the path to what we call lactogenesis stage 2, or the ounces of milk. Also want to watch baby's cues. So a hungry baby is going to have their fists up, be rooting around, etc. And a full baby or a content baby, even if it's for a short time after a frequent feeding, is going to be more relaxed, kind of noodle arms, and at least content for a short time after eating. I will say a caveat is with the earlier preterm you are, in particular we worry about late preterm babies on the normal newborn service, their cues may just be that they're awake and stirring. So they may not be as sophisticated as gaping open mouth and rooting and turning. They may just be starting to wake up. But guess what? An awake newborn is a hungry newborn, and that's time to eat. If their baby is sleepy, and I get this question a lot, what if they're sleepy? I don't know if they'll wake up. Well, first I would say it's not about the minutes they spend at the breast, but it's about the number of times that they go to the breast. And if the baby has cued or awakened or shown interest in feeding, then and they immediately fall asleep, parents can go ahead and express some milk, either right into their mouth or on a little spoon, and give it to them, but don't miss the chance to signal if that baby has stirred. We also say, we have lots of ways to tell if the baby is getting milk when they're at the breast, and that is more important than minutes at the breast. So in the newborn period, they might do suck, 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 and then a swallow. That's a milk transfer. Suck, 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 and then a swallow. So we can teach parents how to be watching for that, for reassurance that transfer is happening. You can also use breast compression or a little bit of hand expression to help. And if it's daytime and the parents are awake and the baby hasn't started to stir at all, then beware of artificial comfort. So I'm showing a baby here that is tightly swaddled with a passy in their mouth. We might miss a feeding cue if that baby stirs, sucks, and then kind of settles. And then another picture of a grandparent holding a baby. And again, they may think, oh, how cute, he's moving, he's smiling, he opened his mouth, and then just rock them right back to sleep. That's an opportunity that we might have missed to do a feeding. So if they haven't stirred, you're awake and it's been a while, remove the artificial comfort. Maybe they just need to be on their backs in their bassinet next to you, and I bet you they're going to start stirring, and then we know it's feeding time. Skin to skin time. So if particularly the late preterm babies or the early newborns, if you feel like they're having a sleepy day, unwrap them, get them down to their diaper, and get them right against mom's skin. So their tummies are against mom's chest. This would be while the parent is awake and able to watch them and make sure they're breathing comfortably. But it's been shown that babies who are skin to skin will cue to feed more often. So that's a great way to get a sleepy baby's attention. And then be careful not to take, or when you set the alarm or you get a baby that you're worried about out of a deep sleep, don't put them right to the breast because, I love to eat. And if you brought me my favorite food at 3 a.m, I'd look at you like you're crazy. So we want to make sure that we give them a chance, even if it's just skin to skin for a few minutes or changing their diaper or something to kind of help them gently wake. And then it's time to try a feeding.